The United States is giving away the medical pot industry. I'm Bloomberg Businessweek writer Josh Dean in New York. Around the world, research into the possible medicinal uses of marijuana is booming. In Israel, Canada, the UK, and Holland, scientists in the public and private sector are working hard to study the plant's constituent parts to develop pharmaceuticals. Some estimate the market for marijuana-derived drugs could be worth $30 billion. And how much of that is the U.S. poised to capture? Zero. While states across the country continue to liberalize their marijuana policy, Uncle Sam is still suffering from a case of reefer madness. In order to develop a drug, a company needs to conduct FDA-approved trials, and to do that with marijuana requires a DEA-approved supply, which since 1968 can come from just a single source, a 10-acre farm at the University of Mississippi overseen by the National Institutes for Drug Abuse. Any person or company who wants to do FDA-sanctioned studies must use marijuana from Ole Miss with the permission of a group set up to study abuse and addiction. Sound problematic? It is. For decades, researchers have had to fight the government to get marijuana for studies, but there's an even bigger problem. In order to commercialize a drug, the company doing the research has to prove that it can manufacture or grow and process that drug according to GMP practices. In short, in the case of marijuana, you need to have your own farm and lab. And right now, only Ole Miss is allowed to have one. For almost 20 years, a man named Rick Doblin has been fighting this monopoly. He handpicked the UMass plant scientist Lyle Craker to apply for a DEA license to grow marijuana for medicinal research 18 years ago, and they've been fighting Uncle Sam ever since. Read more about Doblin, Craker, and the U.S. government's bizarre marijuana monopoly in this week's Bloomberg Businessweek. I'm Josh Dean in New York. You can follow me on Twitter at JoshDean66. You can get all your updates at TikTok.